Hello guys and welcome to another pharmacology class. Let's start. Today we will discuss digoxin. This is the most widely used cardiac glycoside and administered in the presence of atrial fibrillation, atrial flutter, and heart failure. Digoxin, like other cardiac glycosides, inhibits the sodium-potassium ATPases found on the outer cell surface. This causes a higher intracellular sodium concentration, reduced efficacy of the sodium-calcium exchangers, higher intracellular calcium concentration, and eventually an increased vagal tone. In cardiomyocytes, this leads to a positive inotropic effect, a negative dromotropic effect, and a negative chronotropic effect. All in all, cardiac glycosides cause the increase of cardiac contractility, the decrease of AV conduction, and the decrease of heart rate. At low serum drug concentrations, digoxin is generally well tolerated. However, it does have a very narrow therapeutic index, and digoxin toxicity is one of the most common adverse drug reactions leading to hospitalization. Anorexia, nausea, and vomiting may be the initial indicators of toxicity. Patients may also experience blurred vision, xanthopsia, and various cardiac arrhythmias. Toxicity can often be managed by just discontinuing digoxin, determining serum potassium levels, and if indicated, replenishing said potassium. Severe toxicity may result in ventricular tachycardia and requires administration of antiarrhythmic drugs and the use of antibodies to digoxin that bind and inactivate the drug. Digoxin should not be administered to patients that have ventricular fibrillation, electrolyte and fluid disorders, renal failure, cardiovascular disorders, and pregnant women. Digoxin should also be used with caution with other drugs that slow AV conduction, such as beta blockers, verapamil, and diltiazem. That's all for today on digoxin. I hope this video was useful for you. Feel free to share your knowledge in the comment section or ask any questions. Thanks for joining me, and I'll see you in the next video.